Hi friends, hope you all are doing well. Today we are going to discuss about diabetes, one of the most common non-communicable lifestyle diseases in India and other developing countries. Dear friends, diabetes by definition means increased blood sugar level and in our body and decreased utilization of that sugar by our body organs. Mainly there are two types of diabetes, type 1 diabetes and type 2 diabetes. Type 1 diabetes is also called as insulin dependent diabetes, in which our body organ pancreas will either secrete decrease amount of insulin or no amount of insulin, so that we will be in need of insulin. This is rare type of diabetes. It is seen in only 10% of cases. Other type is type 2 diabetes, which is also called as insulin independent diabetes. It is the most common type of diabetes and it is seen in 90% of the cases. There are other two types also called as pre-diabetes, in which there is increased blood sugar level in our body, but it is not there are no symptoms of diabetes. Other fourth type of diabetes is gestational diabetes. It means that type of increased blood sugar level seen in only pregnant women, but after the pregnancy this gestational diabetes will go off. Need not to worry. Now coming to what are the most common signs and symptoms of diabetes, how to assess that we are having diabetes or not. Most common symptom is increased frequency of urination. Yes, if we are having a symptom that every now and then we are going to urinate, then that could be a first symptom. Increased intense thirst and hunger, and increased weight or completely unusual or unexplained weight loss, fatigue, numbness and tingling in our limbs, and blurred vision. Sometimes if there is a wound which is present for a prolonged period and it is not getting healed, then that is also an indication there could be a diabetes. Darkness of the skin under the armpits, thighs and necks is also sometimes a sign and symptom of diabetes. These are like one of the common symptoms that a patient may present with. Now coming to what are the causes of diabetes. Dear friends, most common cause of diabetes in India is overweight. Yes, if we are developing increased weight in our daily life, if we are overweight, then we are having more chances of developing diabetes. Obese patients are also more prone to develop diabetes. Other second most common cause is inactive life, sedentary life. Now because of technological conditions and decreased because of the industrialization, man has been only working in sedentary conditions. So there is decreased physical activity, and these increased sedentary technical conditions in our workplaces is making our Indian people to be more prone to diabetes. So decreased physical activity, sedentary life is the second most common cause. Third most common cause is age itself. If suppose we are more than 45 years of age, then we are automatically more prone to develop type 2 diabetes. Stress of any kind, stress due to some disease or any psychological stress or any other kind of stress, is also one of the risk factor for developing diabetes. Family history is also one of the most common cause of diabetes. If we are having diabetes in our family, then we are more prone to develop diabetes in ourselves also. Other than this one, there are some food habits. Those foods and adulterated drinks which contains some artificial sweeteners are also one of the most common cause for developing diabetes nowadays. Now coming to what are the complications of diabetes. If suppose I have diabetes as a patient, then what could be that lead to? What could be our complications? If I have diabetes, then my blood sugar level will be uncontrolled. It means there will be increased sugar level. Automatically my immune power will be decreased and I will be prone to develop more infections. Secondly, if I have diabetes, I am more prone to develop heart diseases, stroke and cardiovascular diseases like coronary artery disease. Third most common complication is if suppose any patient is having diabetes which is not controlled by medication for more than 5 to 6 years, then he will be developing any of the one organ diseases. That could be kidney called as diabetic nephropathy, that could be eyes called as diabetic retinopathy. So these are like coming complications, so that you should be aware that if you have diabetes, you need to control it with medication. Now coming to what are the management of diabetes. Dear friends, there are three categories of management of diabetes. Either one of that category should not be neglected. This is the first formula. One is diet. Yes dear friend, there is completely different diet management for diabetes. Second condition is physical exercise, physical activity. Third is medication. So remember, the medication is actually a supportive mode of treatment. The actual treatment for diabetes is diet management, physical activity. Then third comes the medication. So in our next video, we are discussing about what are all about the diet management we have to do, what kind of foods we need to eat and what should not, and which kind of physical activity you have to do in our next video. Hope you all enjoy our health tube conditions. Thank you. Stay tuned.